Thank you for choosing Axxess On Demand. Axxess believes in continuing education, and we create content to empower you to learn and grow anytime, anywhere. Let's get started.
Welcome to part 2 of our 3-part series on report management and Axxess Business Intelligence. I'm Laura Barnett, Vice President of Interoperability Sales at Axxess. If you missed part 1 of our series, we covered how spending just 5 to 15 minutes a day in your clinical dashboard sets you up to better understand patient care activities and work toward enhancing the health and wellness of your organization. The metrics Axxess BI gives are actionable today. You can make a difference in the operational management, the clinical outcomes, and the financial success of your organization by using business intelligence through Axxess. To get an overview of operations, users can filter data by branch and group information in multiple ways, such as combining 2 branches or combining different teams. Look at the different payer sources that are offered, as the dashboard shows the organization moving away from Medicare and seeing more managed care patients. All of those payer sources are preloaded for data filtering. Next is case management. This is important because case management can guide operations. We want to know who's driving operations, which accounts are the most viable, and which accounts may need some nurturing. In our first webinar, we showed the ability to view data the way that best fits the needs of your organization, whether that's quarterly, monthly, weekly, or daily. We'll again use the monthly view when we dive into the scorecard. Axxess Business Intelligence is very visual, and information is easy to see at a glance. Information in red is a negative trend. Blue is either positive or neutral. Red indicates things that are at risk, and in this case, that starts with admissions. If we hover over that, we can see a decrease in admissions, and then dig into that detail. Users review this information by one payer source. Maybe there's something going on with contracting, or maybe the staff is not getting required documentation completed in a timely manner, so the payer has stopped giving referrals. This data helps you ask smart questions and get the right answers. Users can also filter to the actual referral source. Losing a key referral account could be why admissions are down, and it's easy to see that at a glance. Hovering over the light bulb on admissions explains where the data is drawn from, and this can be filtered down to the patient level. Let's also spend a little time on discharges. In your career, you've probably met a nurse who load balances when admissions start going up. You also see your discharges start going up, and we know that nurses triage accounts. They'll take on those admissions, but then they all flow those discharges. In this particular case, we see a number of positive outcomes, and our discharges are going down, and that could be tracked back to change management. An operational manager could start to require staff to state all the goals that are being met, or have clinical supervisors review those charts for all met goals. Oftentimes, that clinical supervisor with that different set of eyes can find a skilled need to stay in that home and avoid the revolving door of admitting patients and discharging them just to go back and readmit them again in a few weeks. We talked about referrals, but again, spend some time here. Consider what a downward trend could actually indicate. Potential changes that could impact referrals include shifting account managers or account liaisons, the loss of a key account, or simply the loss of some key nurses who took good care of those referral sources. Dealing with that can institute change immediately. Another operational highlight is your conversion rate. Ideally, that's at least at 90%. All organizations want to keep as much business as possible, and Axxess helps you do that. If business comes in the door and you're not able to accept it, staffing is usually the reason. We have the solution for that with Axxess Care, which connects agencies using Axxess software with qualified clinicians to provide timely care on an as-needed basis. Oftentimes, the financial health of an organization can be corrected just by learning how to use Axxess Care successfully, so pay attention to that conversion rate. Another important metric is non-admissions. We can break these non-admissions into even lower levels and see the reasons behind those non-admissions, such as a lack of staff, no contracts, being out of the service area, or the needed discipline not being available. This happens a lot with physical therapy, occupational therapy, and speech therapy as well, where a referral comes in and an organization just doesn't have the therapies to offer that client. Again, Axxess Care can help. Organizations also need to think about whether a doctor-ordered occupational therapy, and is that needed therapy a transferable skill that a physical therapist could do. Next, we'll hover over that light bulb and show how we calculate productivity points. Points are rated by acuity, based on the OASIS, whether it's a start of care, a recert, a ROC, or a routine visit. This is customizable by organization. Notice how this organization dropped off in productivity significantly. If you're at 50% productivity, you are leaving half your revenue on the table. Having low productivity means low financial margins. It's important to look at what's causing that, such as a lot of new staff or staff who are frequently missing visits. Users can filter these productivity points down to the individual clinician and find out who may need additional guidance or assistance. Productivity is a key area to turning that around. This is especially timely because home health has that 2% sequestration rate coming into effect in July and another 4.6% decrease in reimbursement that's recommended for January with the proposed final rule. This is something we have got to get a handle on quickly. Another item to consider is re-hospitalization rates. It's a clinical indicator as well, but it's on the operational dashboard because operational managers can track those patients in the hospital daily. Account representatives or clinical liaisons can be sent out to manage this patient because many organizations lose these patients to other organizations once they're hospitalized. Lastly, and perhaps most importantly, is reviewing NOAs. Organizations can lose money when they submit the NOA after 5 days. It's one more way organizations are leaving money on the table. Axxess Business Intelligence tracks NOAs beginning at day 3 when an NOA is expiring. Days 4 and 5 will also be noted, but it starts at day 3, so organizations have time to keep their entire reimbursement. The NOA is on the operational dashboard, not the financial, because operational issues are often the root cause of those late NOA submissions. Think through the questions you'll ask your team about why your NOAs are late. Maybe assessment staff isn't completing their OASIS in a timely manner. Maybe they're not turning that assessment in within 24 hours, or maybe the secondary discipline isn't getting out to see the patient. Whatever the case may be, operational managers can correct this and stop losing revenue, especially as we're planning for those reimbursements to decrease. Every single day of reimbursement is vital to the health of your organization. I encourage you to start and end your day in our Axxess Business Intelligence solution. It's going to pay dividends.
Thank you for joining our on-demand training today. Axxess is the only home healthcare technology company approved by the American Nurses Credentialing Center to offer continuing education credits and the most recommended home health software on Software Advice. You can watch more on-demand training videos through our industry-leading help center or at axxess.com, where you'll find tutorials, blogs, white papers, and answers to frequently asked questions. Axxess, empowering care anytime, anywhere.